everybody. I'm Dr. Karthik, Orthopedic Surgeon, working in Global Ortho and Trauma Hospital in Ramnagar, Gandhipuram, Coimbatore. Today we're going to talk about Quervain's disease. It's a French term which denotes pain along this part of the thumb, and this is predominantly due to inflammation of the tendons along the thumb, which goes into the wrist joint, and it causes pain. Now these tendons along the thumb can get swollen along with its sheath, covering sheath, and it causes pain when they rub against each other, and along the tunnel it passes in the wrist. So many of the time it's the ladies who come with these pain, and they complaining pain most of the time along this part and here, and if we ask them to do this movement, it actually worsens their pain. Seen very often in people who do a lot of gardening, who do a lot of golf, and nowadays I see a few children as well coming, because children have the habit of now playing with the phones with their thumb like that. They keep texting the whole day, and when they grab onto a pen very tightly and write for hours together in school, can cause this pain. Teachers at the same time, when they do a lot of correcting work with the papers, it causes pain. And it also happens during pregnancy, but they usually get better when the baby is born. And it can also, anything that does this movement a lot or this movement will bring this pain. And sometimes the software engineers come with a lot of pain because they keep working with the computers. And most of the time it's just an innocent pain, and when you stop doing what you're doing for too long, the pain gets better. But if you can't stop your function, which is bringing about this pain, that's when the problem arises. So you have to be a little bit sensible and try to alter the way you use your thumb and wrist, and the pain starts to settle down. So to start with, give your thumb a good rest. That's the most important thing. And there are a lot of these tiny little braces available in the market. Just wear something like these, which doesn't let your thumb to come down, so it rests your thumb in a position or keeps the thumb in a position which rests it, so that you get a lot of pain relief. So this is one of those little things you can wear. And remember, you wear this when you're working. If you can't do certain function with this, you're not allowed to do that job. This thing is worn especially when you're working. And there are certain gel balls like these, and these also, once the pain subsides, now you have to increase the strength of the tendons along the thumb. So what you do is get some balls. These are not the smiley balls, these are the gel balls, which are quite good to use. So what you do is increase this thumb strength by doing this. Just keep squeezing it like that 10 to 15 times, 2 or 3 times a day. And this you do it once the pain settles down, and then start using this thumb. Very gently and gradually you do it. You don't go like this for the first 10 days and then the pain gets worse. So take it easy and gently. Apply some gel for pain, put some ice pack on it. Those things will help, and physiotherapists got some ergonomic tapes which they put it on the thumb so that it gives you pain relief. And they also do some ultrasound therapy. And there are some painkillers which will help these. And the worst case comes, there are things like steroid injections you can try locally where there is pain, and surgery as well. I've done on a lot of these people who have recurrent pain or very resistant pain which is not getting better by any form of treatment, and surgery is one of the last resorts. So there's quite few things you could do. But most important thing, as I always say, remember, your exercise, rest is the most important thing. Stop doing or alter the way you're doing something which is bringing you pain, then this pain will settle down. If not, it's not going to settle down. All right? Thank you.